Moving in. Good morning and welcome to our IRTA continuing conversation, our weekly or monthly webinar series. Today, we're talking about dental and vision, just an all-encompassing conversation about the different plans that are out there. Just a couple of quick housekeeping details before we get started. All participants are in a listen-only mode. And what that means is that we can't see you or hear you, but if you do have a question or want to make a comment, please drop it in the Q&A section on your toolbar. That way my co-host Gary and Nancy can answer those specifically. If it's something that is directed towards Nathan and the IRTA staff, they'll be able to answer that back to you. If it's something that is very specific to you, they can respond back to you. If not, they will be able to stop the conversation. We can have it address the conversations that go through here as well. We do record this session. We'll put it out on the IRTA website very soon, so that you'll be able to refer back to it as you need be, and be able to share this with some friends, maybe some recent retirees or soon to be retirees that are coming up as well. Grab a pen and paper today. I'm going to give you some phone numbers, a couple of websites, things like that you can get more information on, but also have your smartphone handy. This is simply because it'll just give you the opportunity to use that QR code down there and understand more about your benefits that you have through IRTA and help you get answers to those questions that Gary and Nancy and their teams can give you information about that. Before we jump off in here, Nathan, you want to share with us a little bit what's going on at IRTA today and kind of maybe some legislative issues you're working on?
Well, sure, absolutely, John. Thank you for having me this morning, and thank you for continuing this series. We do feel that it's a very great resource to our members, not only to the ones that we have, to the new ones that are thinking about joining, to share just briefly in an hour or so the benefits offered through you guys at AMBA, who we consider to be kind of like our right arm when it comes to member benefits and services. I actually went to the dentist last week using my AMBA dental insurance, and I'm pleased to report that I have no cavities as of right now. So that's a good thing. Here at the association, it's our spring membership drive. So what we're doing right now is we are reaching out to the teachers who are about to retire at the end of the year. Or emailing them and mailing them and asking them to join the association. And if you are one of those new retirees on the call today, I'd like to invite you to join the association. And then I'd also encourage the dental and vision benefit that is offered through AMBA. It's one of the biggest reasons that a member will join the association outside of the pension and protection benefits that the association offers. And the benefits that both you and myself as a staff receive, I think are pretty top notch. I go at least twice a year for dental and get those cleanings and things every year. So that's something that you will not have as a new retiree post-retirement, is that dental and vision insurance that you may have right now at the state or working for your local school district. Just a couple other things that we're doing here at the office. We have a sold-out Cubs-Cardinals game that we will be going to in May. So if you're one of the members of the association that's going to that, I think it's going to be a great time. And then we are offering a cruise to Panama and the Panama Canal in October. So if that's something you're interested, get on the IRTA website and sign up for that. And then our biennial convention is coming up in October. We're encouraging all members to participate in that and share in some of their ideas and thoughts in some of the upcoming area conferences that are going to be kind of like pre-meetings to the biennial convention, where we have some constitutional amendment proposals and other things that will be voted on at that very important meeting. So, John, back to you. Thanks so much for doing this again, and I'm looking forward to hearing what you have to say.
You bet, Nathan. Thank you very much for updating your members, and always excited to hear about the activities that IRTA is doing with their members and getting back out there again. It's pretty exciting to have that. So appreciate you joining us, Nathan. My name is John Green with Association Member Benefits Advisors. I live a little bit north of Houston with my wife, who's an elementary school teacher. My daughter is finishing up her student teaching here and graduate next month. And I've spent the better part of my career, 30 plus years in schools, helping active educators understand what their retirement years are like. But today I'm coming to you from Austin, Texas. I have just joined probably about 1,100, 1,200 of your retiree counterparts down here in Texas. And they are at the Capitol today pushing very hard for a COLA. And so you know what the value of a cost of living adjustment is there in Illinois. We haven't had one in the 2 decades in Texas. And so they're pushing hard for that today at their day at the Capitol. So I'm in a hotel room today, a little bit darker room in here. So I apologize for the lighting, but I am joined by 2 of my very good friends, Nancy Kramer and Gary DeVito. They are our leaders with AMBA in Illinois. They, and along with their teams, are glad to serve you and happy to be out there with your local units and chapters all across the state. And we'll be seeing you very soon. So appreciate you joining us today, Gary and Nancy. If you've got questions, feel free to drop those into Q&A and they can monitor that as we go through here. But just a couple of reminders here. Nathan hit on this really, really strongly. IRTA protects your pension and your benefits that you receive, that you work so hard for whenever you left the school district. But the thing that I enjoy most that we're doing again, and Nathan mentioned it, is getting you back connected with your local community. The baseball game is great. The Panama Canal Cruise sounds like a lot of fun. So IRTA does a lot of different things with you and for you. And more importantly, they keep you connected, and they keep you connected on those things that matter most, the community after you retire, but also those exclusive benefits and discounts and things that that come with your IRTA membership, and some that you have access to as an IRTA member. And there are some advantages, and we're proud to be a partner with the IRTA at AMBA. They can help fill some of those gaps that aren't covered whenever you left the schoolhouse, either from the state or from the district benefits, things like that. They're portable. We have a lot of IRTA members that move out of state, or they may winter down in Arizona, Texas, or Florida. They're portable if you leave the state for whatever reason. But a big reason that IRTA members really appreciate their benefits is that they can extend them to maybe family members who have aged out of benefits, adult children, or maybe they can be responsible for taking care of their parents through some of these benefits as well. So there's a lot of things that that have advantages with IRTA and AMBA together. But today we're talking about the dental and vision plans. And Nathan was a great straight man for me today. We're going to talk about this for several reasons. One, I want to make sure we dispel some myths about, or miscommunication possibly, about being an IRTA member and dental vision coming automatically with your membership. But we want to talk about the plans. We want to go through this because this is the most popular plan or benefit that IRTA members take. It is one of the major reasons they become an IRTA member, and we're very excited about that. So we want to walk through today and talk about your endorsed dental and vision benefits. We want to show you a new free benefit for dental policyholders that I was not familiar with until recently. Talk about your resources, where you can get your cards, information about providers, things like that, and make the most of your options. So keep those Q&As burning up in there. And Nancy and Gary, if there's something that the group can benefit from, stop us and let's go through here as we walk through this. So let's talk about dental. So as an IRTA member, you have access to dental and vision coverage. It doesn't come to you automatically as an IRTA member, but you have access to it. So you've got 2 different plan options to choose from. But the most important thing about those plan options is it gives you freedom. You can go to whatever dentist you want. Now you can use your own, or you can use one in their network and save a little bit more money or have greater coverage, for lack of a better term, if you use the Emeritus Network dentist. Emeritus is one of the largest and oldest dentist networks in the nation, and they're a phenomenal provider. They've been a provider for AMBA for many, many years. Great customer service, but more importantly, they give you your choice, is what you want. You can enroll whenever you want to. So if you wanted to enroll today, your coverage would start very soon. If you enroll the last week of the month, you could effective the following month, but you can select what month you want to start. If you want to coincide it with a plan that's expiring, you can do that. It allows you to do that with no waiting period, so that you don't have to worry about having a gap in coverage. There's no long-term commitment or contract for you as well in there. And then adult children are eligible as well. And then you've got a 2-year rate lock and a rewards program. And so we're going to talk about that rewards program as we go through here. So let's go ahead and look real closely at the plan, because most plans are driven around the services that are provided. You have 2 different options in the state of Illinois or through IRTA, no matter where you live. You have a platinum plan option and a gold plan option. I want to spend a little time breaking those down for you. Most of our members are in the platinum plan, but for those of you that maybe have a little bit tighter budget constraint, something like that, the gold plan is an option for you. So you have your type 1 through 4, your preventative services are type 1, like Nathan mentioned, your general exams, your cleanings, things like that. Basic services are type 2, fillings and x-rays. Type 3 are major surgeries or major services like crowns and dentures. And then type 4 are implants and other implant type of services. In the Platinum plan, for type 1 for cleanings in or out of network, it's 100% covered. And then you start to go down through your basic services, your major services, and others. If you go to an in-network dentist, there's 80% coverage up to a maximum of $1,500 per calendar year per person. If you go to an out-of-network dentist in the Platinum plan, you have about 10% less coverage. These are all pretty standard across the board, comparable to other plans out there. You have a $1,500 a year per person calendar year coverage. Your type 1 preventative services, there's no deductible whatsoever. Types 2, 3, and 4, there's a $100 per year deductible with a $300 family maximum deductible. Now, under the Gold plan, it's a little bit different. Your same type 1 preventive services, those are covered 100%. Then you get into your other type of services. Depending upon how long you've been with the Gold plan, your benefits increase over time, regardless of whether you're in network or out of network under the Gold plan. Your first calendar year, your type 1 services are 70%, and then those step up 10% each year. Into the third year, you have a 90% coverage level on your fillings and x-rays, 50% on major services. Type 4, your implants are not covered under the Gold plan. So just make sure you understand that. And then you have $1,000 calendar year coverage there with a $50 per person deductible, including type 1. So just your normal dentist visits are in there. Type 1, there's a $50 deductible, and there's no family maximum. There were very few people have that big of a family that they would meet that family maximum. So real quickly, two different type of plans, depending upon network versus in-network, whether your coverage levels are at a certain level in that regards. Now, we talked about the rewards program. The rewards program is extremely unique, but it's designed for two different things. One, is designed to reward you for loyalty, for staying with the plan, but two, is designed to reward you for using your benefits. Any person, any dentist will tell you that good preventative care saves a whole lot in the long run. If you can prevent problems before they happen, then you don't have to worry about major medical issues going forward. With the rewards program through IRTA, as long as you have at least one dental claim a year, so we're talking about a routine cleaning, a filling, a crown, something like that, and keep the total amount of your paid benefits, not only what you pay, but what's covered, under $750 under the Platinum plan or $500 under the Gold plan, you are qualified to take an additional $250 into the following year. And the most you can carry forward is $1,000. I'm going to show you how that works in a moment, but if you save up your benefits, for lack of a better term, but you still use them because we want you to take those claims, we want you to take those preventative visits and your checkups, you can have $1,750 the next year. With the Platinum plan or $1,250. Ultimately, you can have $2,500 in the long run. So it's really a neat plan. It allows you to save up for major repairs, things like that. But more importantly, we want you to take those benefits. Here's how it would work. Say this year, you doesn't matter if you're whatever plan you're in, you go in and you have a routine cleaning or a cavity filled, and it's $105. No matter what the plan pays, as long as you keep that amount under $750 or under $500, then you'll take $250 into the next year. And in the Platinum plan, you'd have $1,750. In the Gold plan, you'd have $1,250. And again, as I mentioned, you could carry over a maximum of $1,000 with IRTA with your rewards program. So Gary or Nancy, any questions that have popped through that the group could benefit from hearing?
Yeah, it's really more of a general question. There was a question that was asked. Susan had attended the session on discounts on travel and restaurants, et cetera. She was wondering, where can she find the link to that site? And we did give her the answer that, for any of these sessions, you can go to the IRTA website, which is irtaonline.org, sign in, and you'll be able to get the link to these sessions.
Okay, great. Any dental questions that have popped through that the group could benefit from?
Yeah, no, not the
Okay. All right, so not everybody at large. Look, if you've got questions, drop those in there. Nancy and Gary are cleaning those off individually. But if it's something that the group can benefit from, we'll stop along the way. So you've got the rewards program, you've got the coverage, you've got your maximum out of pockets. One of the neat features about this plan is you can double dip. We have many members that maybe have coverage from their spouse's plan or may have gone on COBRA from the school district that they left, and they have dental coverage, and they say, well, do I need or can I get duplicate dental coverage and use it for more major procedures or multiple crowns, things like that? Yes, you can double dip, which that means that you can have your plan through a spouse's provider through the school district, but you can also have the IRTA plan through AMBA, and you can use those benefits the same because they don't coordinate. There's no worry. You just have the dentist file on both plans, and you've got double coverage that way. So an interesting way to use that. Feel free to use that benefit. It's a very nice feature that's out there as well. So here are the rates. As I mentioned, you've got the platinum plan and you've got the gold plan. For the member only rates for platinum, it's $66 a month. For the gold plan, $38 and change. And you can see the cost for the family and the member plus one. The member plus one does not have to be a spouse. It can be just one other adult child, that type of thing. So I encourage you to take a look at that. I'm going to show you how you can find that in just a moment and how Gary and Nancy can help you with that. Now, we get a lot of questions about how do I file claims? What do I do? Things like that. The nice thing about the Meritas program is, one, because it's so large, dentists know it. All they have to do is look you up either by the social security number, date of birth, all that kind of stuff. They've got the ability to find that out. But if you've got a question about your claim, you can go to Meritas Dental, or you can call 1-800-487-5553, and they can help you walk through your claim, find out what's covered out there, things like that as well. If you're new to the area, or if you want to know, is my dentist in the network, you can go to dentalnetwork.emeritus.com, and you can go out there and it's going to ask you what type of plan you're on. You just simply select the classic PPO network, and it will tell you what dentists are available in your area. So it's very simple to use, especially for those of you who snowbird south in the winter. You can get a dentist where you are, then you can have a dentist in the south if you want to. So, but you can always check it out and find out what dentists are in the network out there. If you have questions about your current account, if you're not sure if you're enrolled, or you have questions about billing, something like that, you can simply call us at AMBA at 866-615-4051. And we'll be able to help you address any questions that you've got there. If you need to change a credit card, something like that, because yours expired or you got a new credit card, you can do that. Now, the questions that we get often are about dental cards. If you enroll, you'll get a dental card probably about 2 to 4 weeks after you enroll. But if you need new cards, if you need your replacement cards, you can print your own at emeritus.com. You'll need to register on the site. And you can print those right there on the spot if you need to right away, because your coverage kicks in immediately. Or you can contact us at inquiries@amba.info, and it takes about, like I said, 2 to 3 weeks to get those cards delivered out to you in the mail. So different options that you've got out there that have come in that way. So Gary, I see the Q&A numbers ratcheting up. What's up?
So one of the questions is that for 100% coverage for out-of-network services, one of our members, it was only covered by half of the submitted charges. I think I know how to address that, but maybe it'd be better if you could.
All right, that's a great question. You'll notice on there, and I'll go back to that slide so we can address that and have that conversation, because I do want to be clear about this. There are what are called usual and customary charges. Sometimes they're referred to MCEs. It's an industry term out there, but you see the asterisk out there as far as the in-network and out-of-network being covered. As long as it's usual and customary, it will be covered by Meritas at 100%. It's when the dentist, oftentimes they will combine the cleanings with certain x-rays or panoramic x-rays that are more frequent than are called for, usual and customary things like that. That's when you get the costs in there. Oftentimes they'll throw in fluoride treatments, or I don't know, my dentist loves to try out every new gadget that he has. And it's incredible what you see, these 3D mapping images and all that, but usually those are not covered by your dentist, especially if they're out of network. So that could be the issue there. So I would encourage you, if you've got a question, we'll go back to that claim number again, and you can find out, and they can tell you exactly what is covered under the usual and customary charges. Then you can decide if you need to go to a different dentist as well. So that's a great question. I appreciate that coming up. And usually, like I said, we only see that with those out-of-network dentists in that regard. Anything else, Gary, that's popped up in dental before we jump ahead?
Yes. So are you able to have 2 cleanings per year on this plan?
Yes, that's usually the usual and customary now is to have 2 cleanings under this plan. X-rays vary based on when you do those, so it may not always cover 2 sets of X-rays, usually just once a year.
There's a couple questions on the rewards. One person, could you just re-explain it a little bit different?
Okay. Absolutely. Let's go back on the rewards, because again, what we want you under the rewards is we want you to use your coverage. That's the most important thing. You have to have a claim every year to carry forward any coverage, any rewards coverage. So as long as you have a claim and you keep it below the threshold for your plan, the platinum plan 750, so that's a pretty large dental claim, or 500 for the gold plan, as long as you keep it under that and have at least 1 claim a year, you'll carry forward $250 worth of coverage into the next year. You can stack that up to $1,000. So if you go to the dentist for 4 years in a row, you could then have up to $2,500 of coverage under the platinum plan, or $2,000 under the gold plan. And then say you needed a crown and a root canal, or you needed some denture work or a bridge or something like that, then you would have much more money that would go towards your plan in your coverage. So again, it's a really neat feature. It's very unique to dental plans. Most don't have these, but Ameritas wants you to use your coverage. They want you to go to the dentist at least once a year and get these things checked out. So hopefully that answers your question there, and keep those coming. So Gary, I'm going to move forward here unless there's anything else that's specific out there that we need to address.
And just on that same subject with the rewards. So one of the questions is, what will rewards pay for? And the answer to that is the same services that it covers in the rest of the policy. It gives you extra coverage during that plan year when you earn those rewards.
Exactly. So if you've got a procedure that needs to have $3,000 in cost, it just goes more towards that. It's not going to give you any new benefits. It's not going to cover something that wouldn't be covered anyway. But for some of those procedures that may have a 50% coverage level, this just means you've got less out of your pocket. It goes towards more of your benefit. So great questions. Keep those coming. This is a new benefit that I was not aware of, and I don't know if Gary and Nancy were aware of. If you're a Ameritas dental policy holder, it comes with a free prescription drug card. And this gives you discounts at 60,000 plus pharmacies all across the country. You can save 65% on generics, up to 40% on name brand prescriptions. This is not, and I repeat this is not a Part D Medicare prescription drug plan substitute. This is just an additional savings, just a little bit extra, thanking you for being an Ameritas policy holder. If you're a policy holder on the dental, you can go out to Ameritas.com. If you don't have an account, you can sign in and create an account out there and simply print this card, take it to the pharmacy, and start to receive your discounts that way. So just a little bit ways to stretch your pension dollars a little bit more, especially in this inflationary environment. So that's a nice benefit for you going forward. So now let's talk about your vision plans. And your vision plans, they are offered through the VSP network. They are the largest network that's out there. They are in rural locations. They are in major metropolitan areas. A lot of them are in one-stop shops, meaning that you can go get your eyes checked out and you can get your eyewear taken care of, like at a Walmart Supercenter, some places like that. They are network, but you get at network and in-network benefits. You get an exam every 12 months. That's covered. You get prescription eyeglasses with a $25 copay. Your frames are covered every 24 months. You get an allowance for those frames. Most of them are $150 allowance. Some have certain features, that featured brands, you can get an extra $20 savings on those or allowance. Then you get a 20% savings on those that over your allowance. So if you really want those designer frames, things like that, you can get that as well. Now, your lenses are covered every 12 months. They're covered 100% for your standard progressive lenses, including single vision, lined bifocal, and lined trifocal. Those are covered 100% every 12 months. You get an additional savings of 20 to 25% if you're using those non-covered lenses, like the non-lined bifocals or trifocals, or the UV protection, the scratch coating. You get an additional discount on top of what your allowance is for that. If you do use contacts instead of eyeglasses, you get 12 months of coverage every 12 months. It's usually $150 credit for that. You get an additional 20% savings on eyeglasses or additional pairs of glasses. And then we have a lot of members that will use their savings for LASIK surgery, or they'll use their savings, significant savings, after they have cataract surgery. Then they get the special glasses that are needed at a much greater reduced discount. They can save quite a bit of money that way as well. So lots of different coverages out here. I'm going to kind of walk you through that to show you, because you do have in-network coverage, and then you have out-of-network coverage, but it's at a limited rate or limited reimbursement amount. If you go to a VSP provider and network provider, your annual exam is covered in full. So is your single and bifocal and trifocal lenses are covered in full. Your standard progressive lenses are covered in full. Your frames, depending upon the type of frame you choose, $150 to $170 worth of allowance towards those frames. Contacts, for elective contacts, are $150. If your doctor says you have to have contacts, then that's treated just like lenses, and they're covered in full if they're medically necessary. If you go to an out-of-network provider, you can see those coverages there that way. Now, what I do is I go to an in-network provider at a Walmart near my house. I get my exams covered in full, and then I take my prescription and I go to 1-800-CONTACTS or those online contact providers, and my $150 gives me more contacts. Usually will provide me with more contacts than I can get there at the Walmart Supercenter. So again, you can use your benefits in a wide variety of ways. Oftentimes I'll go in and have my exam, and every couple of years I'll get fitted for some nighttime glasses, things like that, pay a little bit extra, those type of things. So it allows me to have a lot of variety in how I use my coverage, have this for all of my kids as well. And it is a great plan. It saves us quite a bit of money because we all have corrective lenses, contacts, things like that. So very easy to use, very simple to use. There is no benefit card with this, meaning that you don't have a card that you show. It is something that is just simply go up to the vision care, and they can look you up that way. Now, the rates are very inexpensive. You get in-network and out-of-network benefits. For a member only, it's less than $12 a month. So if you get an exam, glasses or contacts, you're going to save far more than that. Member plus one, a little less than 21, and a little bit over 26 for a family member, for a member and family. Now,
Hey, John,
yes, sir.
a couple quick questions. One, going back to the dental, one member had indicated that she was getting 3 cleanings per year covered. And then there was a question that another member did ask, are 3 cleanings covered per year for the dental program?
I have not seen that as a planned document, but oftentimes what will happen is I know that dentists will, if you've got, I'm going pretty deep, no pun intended, if you've got where you need deep cleaning under the roots and the gum lines, oftentimes the dentist can get that pre-approved through the provider to say, hey, to avoid root canals and avoid these type of things, this needs to take place. And so that would be handled between the dentist and Emeritus directly. So I haven't seen it in the plan document saying 3 cleanings a year, but oftentimes I know that if it's medically necessary, then the Emeritus will approve that.
Okay, and then going back to the prescription card, the question is, will this cover in addition to what Aetna is covering for their health insurance? And
there's no coordination. It's truly a discount. So if Aetna provides a better discount than what this one would, of course, you'd want to use Aetna. So I don't think it will say, like, if Aetna gives it for $10, you're going to get 60% off the 10. It's usually just a formulary that is done by the provider. I've seen some people, they will take that card in, and Walgreens will say, hey, we've got a deeper discount than what this card provides. So it will, worst case scenario, you're going to get the best of all worlds But that way, it's just another peace of mind. If you need to use it, you've got that. So I know you have very good coverage there in Illinois, especially with your medical plan.
Okay.
All right, thank you. Keep those Q&As coming there. Some key vision plan. If you've got a claims question, you can call VSP directly at 800-877-7195. That's the same phone number to find out if they're who's an approved provider, or you can go to vsp.com and log in there. Again, our phone number at AMBA, if you have billing questions, 866-615-4051. Now remember, VSP does not issue ID cards for your vision plan. All in-network providers, they'll do an online verification. It's very simple. They know how to do that. Most out-of-network providers know how to do it because VSP is very familiar with them. But they can call 800-877-719 to verify that coverage. It's very simple, very easy to use. That's out there for you. So again, take advantage of your plans out there. Those are great for you. They're the most popular benefits for IRTA members. The other popular benefit is the passport program. And I always want to talk about this on all of our webinars. The April offers are out there right now. You can go to myambadiscounts.com and get out there and take a look at what's available to you. I will tell you right now, if you want to do any type of hotel stay between now and Memorial Day, hotels are offering huge discounts all across the country, especially post-Easter. An example, the Great Wolf Lodge up in Gurnee, you're saving close to 75% off. You can get a $400 family suite for $99. And that includes water park access. So there's lots of stuff. You don't take your grandkids up there, lots of fun that way. Cruise lines are offering lots of discounts. Nathan always reminds me about his Panama cruise coming up here in the latter part of the year. But if you're a cruising fan, now's the time to jump on some of these discounts that are out there. Mother's Day is coming up. Flowers are 15% off through 100 Flowers. And if you're needing an appliance, whether it's a big appliance or a small appliance, Whirlpool is offering sizable discounts on major appliances and small kitchen top, desktop, or countertop appliances as well. So take advantage of these discounts. Let this be something that saves you even more money using your IRTA membership, and that's free for you. A couple of quick reminders, and then we'll come back to wrap it up with some questions. We have a pre-retirement seminar coming up on Saturday in May. If you know any educators who are thinking about retiring in the next 3 to 5 years, let them know about this webinar. Nathan's going to bring all about what's going on and how to understand your benefits, your retirement, your pension, how that works. It's a great way to introduce them to IRTA. It's a great way for them to become a member even before they retire and take advantage of the benefits. Then we're going to come back in June, and Nancy and Gary and I are going to talk about how to protect your nest egg. There are 5 major threats to the money that you've saved, that money that you've saved outside of your pension. And we're going to identify each one of those major threats, show you how you can protect that nest egg, and so that you don't have to worry about your retirement years and that money that you've saved up. And then in July, right in the peak of travel season, we're going to talk about the emergency transportation issues in the state of Illinois and show you that every time the federal government tries to do something to regulate ambulance providers, how those ambulance providers get around that and what you can do to solve that. So join us for that. Be on the lookout for emails from Tricia and from IRTA, and check out on Facebook and get involved with these webinar series here. So I'm going to open it up. Gary, what are the questions that we had come in here in the last few minutes?
Sure. So Karen asks, some vision providers do not allow you to use insurance or will not replace lens in existing frames. Do in-network VSP providers, will they use existing frames for the lens replacement? I'm guessing that would probably be an individual case basis per provider. Is that a fair statement, John?
It would be a fair statement, but I'm trying to think. My daughter just had hers done, and she uses glasses most of the time. And she always says she's going to get a new frame, but she just got lenses and they put it in the frame. So there was not a problem with the provider doing that.
Okay.
So I wouldn't think it's an issue. Again, that's one that I'd want you to clear with VSP, since I'm not the VSP source of truth on that. But from my own personal experience, yes, our provider did that as well. So good question.
Okay. And then Paul asked, will we get a copy of all the slides? And again, the whole video will be available on the IRTA website sometime next week, John, is that correct?
if I can get it back today, I'll get it out to IRTA and get it up by the end of the week, but it'll probably be early next week at the latest and make that available to you as well.
Okay. So here's a question. I've had periodontal surgery twice over the years. Now see my general dentist twice a year and see a periodontist twice a year. I see someone every 3 months for my dental care. Will I continue to get these services paid through my Emeritus insurance? If they've been covered, I would assume they would still be, right?
If they've been covered by Emeritus, I would not see why they wouldn't be covered. I would always, and I know my dentist does this, they do the pre-treatment, for lack of a better term, or they get their plan of treatment approved beforehand. Again, that's where you started seeing the 2 and 3 times a year with the deep root cleaning, things like that, that have been approved there. I'd highly encourage you to have your dentist get that approved in advance through Emeritus so that you can make sure that you've got the continuous coverage that you want to receive. Good questions out there.
And someone asked for the AMBA phone number. Maybe at some point you could bring up all the phone numbers once again. Another person did ask, how do they get the prescription discount card?
Okay. All right. We'll do 2 things. The prescription discount card, you would, if you are a dental policy holder, you would go out to emeritus.com. And if you haven't signed in, you'll need to log in, and then you can go print your dental, or not your dental card. You can print your dental cards there, but you can also print your prescription drug card out there as well. I'll go back and provide the AMBA phone number at the end once we sign off, and I'll just leave it up there for you. But if you've got questions and you want to have deeper conversation about your benefits with IRTA and through AMBA, take your smartphone, open up your camera feature, and hover over that QR code. Don't take a picture of it, but a little form will pop up, and you can ask about dental and vision. You can ask about a benefit review and get a lot of these questions answered. Gary and Nancy and their team will be down in Springfield tomorrow and can actually call out and answer those questions for you, get you set up for an appointment to cover all of your benefits and make sure that you understand the tremendous access to benefits that you have through your IRTA membership. So use your smartphone for that QR code. If you're on your smartphone or if you're on an iPad, something like that, you can simply email me at johnjon.green@amba.info. johnjon.green@amba.info. So I'll leave this screen up for just a little bit longer. Wrap it up by thanking you all for joining us today. I'll leave the screen up, and then after a couple of minutes, I'll go back to the phone number screen for Emeritus that'll have the AMBA phone number as well as the Emeritus phone number on there as well. So Nancy and Gary, thank you very much for joining us this morning. As always, we appreciate your help. Have great travels to Springfield tomorrow. Again, use this QR code. Let Nancy or Gary and their team answer questions for you about all of your benefits and show you how they all work with what the state provides for you, what you've earned whenever you left the schoolhouse. So again, thank you all very much. Nathan, thank you for your time today. Have a tremendous rest of your week, and we look forward to seeing you next month or on future webinars as well. Take care, everyone.
Thank you all.